I normally try to steer clear of any Twitter beefs. So why did I find myself in this one over the course of the holidays? Pretty innocuous, I guess. It's the standard hyperbolic counterpoint to the Sky News and Herald Suns of the world that's cultivated such a loyal following.
I'm Troy McClure.
Making a point about media bias is fine. Everyone gets that. Media bias exists. It's kind of like saying that the sky is blue at this point. And the New South Wales government has generally had a fairly easy run of it, even through their many scandals. That said, there are many examples of media bias in action. It's just that I don't think this is a particularly good one. It's based on some fairly shaky foundations. Let's call them some factual liberties. Why did I respond in the first place? That's a good question. I didn't want people to take the initial tweet as an indication that things in Victoria weren't that bad, on the basis that apparently New South Wales was worse. Even if that were true, accepting a standard of scraping past the worst is not a standard we should really be comfortable accepting. To be fair, it wasn't so much the initial tweet that got my goat. It was the lengthy follow-up and the way that so many people seemed to hang off the guy's every word without so much as a critical thought. Let's break down what he said. Firstly, everything is worse in New South Wales. Any problems in New South Wales are being met with silence. And finally, the tweet infers that the Victorian government has been unfairly treated when it comes to the media covering problems within the healthcare system. To summarise, he later posted, New South Wales is performing worse than Victoria, but getting favourable treatment. I think his point is fairly clear. Now I'll do what I couldn't in the space of a few tweets. Slowly break down the statement to highlight why it's problematic. And not just because it's based on some shaky assumptions to begin with.
Can we please just start?
Everything is worse in New South Wales. The short version response to that statement, unless there's some official data out there that I haven't been able to find, this statement
is false.
As of pulling this together, New South Wales and Victoria had both posted data in relation to ambulance response times and emergency department care covering the July to September 2022 period. Let's start with ambulance response times. Victoria and New South Wales categorise and report the severity of their calls slightly differently. For example, New South Wales have a number of priorities ranked in order of severity, from priority 1A all the way through to priority 9. Victoria, on the other hand, has priority codes and dispatch codes, just to confuse things. On top of that, as the Productivity Commission note, caution needs to be taken when comparing jurisdictions, due to the differences in when response times commence. Now, with all those caveats out of the way, the most reliable apples with apples comparison you can make based on the available data is on the highest severity or priority calls. These are the calls clearly defined as life-threatening. In New South Wales, the highest priority ambulance call is a priority 1A. Currently, in Victoria, the highest priority ambulance call is a priority code 0. Both are reserved for patients with life-threatening conditions. If you do need to make a call, this is the type of call you'd want an ambulance to respond to ASAP. For the period July to September 2022, the median response time for a P1A in New South Wales was 8.8 minutes. The median response time for a priority code 0 in Victoria was 9.1 minutes. 20 seconds mightn't sound like a lot, but in a life or death situation, one state would appear to be doing better than the other. Not sure about you, but if my life depended on the arrival of an ambulance, I'd probably prefer them to arrive sooner rather than later. It's worth pointing out that when New South Wales recorded the median P1A response time of 8.8 minutes, these were the state's longest wait times since records were made publicly available. Quite obviously that is a bad thing, but do you know what's worse? The Victorian median response times for a priority code 0 are even longer and have been consistently for some time. Coincidentally, do you know how I knew that New South Wales experienced the worst wait time since records were made publicly available?
I do, but you're going to tell me anyway.
Because it was covered quite extensively in the media of all places. Just a side note, when a health system is struggling, people start to notice.
Ambulance wait times are now the worst they are in a decade.
No point, it's a joke. They're announcing it now just so that they can win an election when they didn't care about the issue 2 years ago.
It's newsworthy.
Unions claim the New South Wales ambulance service is at breaking point.
It gets reported.
As ambulances mount the footpath, patients are wheeled in off the street.
It's the latest example of how under pressure and under stress our emergency departments actually are.
It's not met with silence.
One of New South Wales's biggest hospitals is allegedly at crisis point. There are claims of deteriorating care at the John Hunter Hospital in Newcastle.
Okay, but that's just one metric.
Very true.
Let's look at some more. How long it takes to get an ambulance in a life or death situation is only one measure of how a healthcare system is going. Another important measure is after you've been picked up by the ambulance, how long does it take to get you transferred from the ambulance to the emergency department? Again, let's look at the July to September 2022 period. The most recent data available. New South Wales reported that 74.8% of patients were transferred from paramedics to emergency department staff within 30 minutes. Victoria has a lower reporting bar, as you'll see. Victoria reported that 59% of patients were transferred from paramedics to emergency department staff within 40 minutes. That's right, Victoria reports against a far less aggressive target of 40 minutes, yet is still well behind New South Wales. If only 59% of patients are getting transferred within 40 minutes in Victoria, you can safely assume that the percentage is even lower at the 30-minute mark. That's a significant difference that may go some way toward explaining why Ambulance Victoria had to call so many code reds in 2022. If an ambulance is taking longer to offload patients, it stands to reason that they then spend less time out in the field, if you like. I mean, if none of that's enough for you, the Australian Institute of Health and Welfare released a huge amount of data early in December 2022, including their Australia's Health 2022 reports. Some of the highlights from the reports, from a New South Wales perspective at least, were the New South Wales Emergency Department performed better than any other state or territory in Australia, seeing the most patients on time with the lowest wait time. New South Wales elective surgery was second best in the country in terms of treating patients within the clinically recommended timeframes. This is consistent with previous data showing that New South Wales returned the highest percentage of patients treated within the national benchmarks for emergency department care. It also showed that wait times were below the benchmarks. Do you know which state is consistently bettering the national averages there?
I bet you're going to tell me.
New South Wales. Do you know which state is below the national averages?
Wait a minute, let me guess.
Yep, Victoria. New South Wales emergency departments are seeing the most patients. I know what you're thinking, of course they are. New South Wales has a bigger population. Don't worry, I've got you. Based on emergency presentations per 1,000 population, New South Wales is still seeing more patients. So you manage to get an ambulance in a life or death situation, you get into the emergency department. What happens if you end up on the elective surgery waitlist? Elective surgery is non-emergency surgery that is medically necessary but can be delayed for 24 hours or more. When you're placed on an elective surgery list, a clinical assessment is done which determines the urgency with which the surgery is required. This is the clinically recommended time. Put it this way, if you need elective surgery, you'd want it to be done within the clinically recommended time. Unfortunately, like a lot of the data kicking around, we can't really make a direct apples for apples comparison when it comes to comparing elective surgeries conducted within the clinically recommended time, because clinical urgency categories aren't comparable across all states and territories. With that said, based on the categorisations used, New South Wales admitted 83% of elective surgery patients within the clinically recommended time, while Victoria admitted 80%. It's close, but when it comes to wait times, so how long someone has to wait if they haven't been admitted by the clinically recommended time, here's where there's a significant difference. In New South Wales, you'd wait on average 91 days if you hadn't been admitted by the recommended time. In Victoria though, you'd wait 211 days. None of this is to suggest that things are all rosy in New South Wales. The healthcare system there is clearly struggling as well. But compared to Victoria, I think the data speaks for itself. So to recap, based on all the data we've looked at so far, in a life or death scenario, an ambulance will get to you sooner in New South Wales than Victoria. You'll be transferred from the ambulance to the emergency department significantly quicker in New South Wales than Victoria, even though New South Wales receives significantly more emergency presentations. If you need elective surgery, you're more likely to get it done on time in New South Wales, but if it's not on time, you'll wait significantly less overall. New South Wales is performing worse? Really? Okay, let's take a quick look at the elephant in the room. COVID. When it comes to the COVID death toll, Victoria is leading the country. Why mention COVID? Well, 89 days before the Victorian election, do you know what we were seeing in Victoria?
Please, tell me.
The impact of the Victorian government's decision making. This leads us to a slight segue.
I see what you did there.
In all the Twitter hullabaloo, I'd posted that there had been a few Victorian government failings when it came to healthcare. One of those failures was the failure of the Victorian Health Minister to take on the health advice provided to her by the Chief Health Officer. This has been widely documented, and honestly, I didn't think I'd have to justify the point, but apparently I did. So let's take a trip down memory lane. So we can all recognise that when someone refuses to acknowledge that the Victorian Health Minister ignored health advice from the Chief Health Officer, then they're probably gaslighting you. Let's start with the health advice. In Victoria, when the pandemic orders are made, the Victorian Health Minister is forced to release the health advice that they've been provided in making their orders. You can find all these documents on the Department of Health website. This is how we know that on the 7th of July 2022, the Victorian Chief Health Officer provided written advice to the Health Minister. Keep in mind that at this time, there were signs that Victoria was well on the path to what would prove to be a brutal winter wave. The health advice to the Health Minister was detailed, clear, and unambiguous. On mask wearing, the advice was clear. Based on changing epidemiology and signs of healthcare system strain, the reintroduction of masks as a requirement in certain settings was both warranted and proportionate. Mask requirements were a low-cost intervention and one of the more rapid means for reducing COVID transmission. This was all backed up by science, modelling and, dare I say it, common sense.
He dared.
Okay, so here's the real kicker. The Health Minister, Marianne Thomas, was provided with advice that said increased coverage of face masks could reduce infections and hospitalisations during the July to September peak by up to 20% and reduce deaths by up to 15%. The following day, there was a meeting between the Health Minister and the Chief Health Officer, where the CHO once again provided his advice, which was minuted. So to recap, on the 7th of July 2022, Marianne Thomas, the Health Minister, was provided written health advice from the Chief Health Officer that said mask requirements should be reintroduced in certain indoor settings due to changing epidemiology and the sign of healthcare system strain. And increasing the coverage of face masks could reduce infections and hospitalisations by up to 20% and deaths by up to 15% in the coming 3-month period to the end of September 2022. That's documented. That's in writing. That's not up for debate. So jump forward to the 12th of July 2022, the Health Minister holds a press conference to outline the changes to the pandemic orders. It was a press conference every bit as bad and evasive as what we'd got used to during the 2021 New South Wales lockdowns. Here's Marianne Thomas.
The Chief Health Officer has provided his advice and I have accepted his advice, except that I have chosen not to extend mandates for mask wearing in some of the settings that were recommended to me by the Chief Health Officer. I have had the opportunity to consult with industry leaders. I have assurances from business and community leaders that they will work actively to encourage mask usage.
Yeah, that'll work.
So, she rejected the recommendation from the CHO to reintroduce mask wearing requirements and instead consulted with business and industry leaders. Maybe you find the word ignored too strong. Maybe you'd like to dismiss it as
hyperbole.
Maybe it's uncomfortable to acknowledge that a government that had staked its reputation on
following the public health advice, following the advice of experts,
was now publicly ignoring health advice. I don't care. Would it make you more comfortable to say that the Health Minister opted to take the feedback of business and industry leaders rather than the advice of her own Chief Health Officer on a public health matter? Ignore, disregard, dismiss, refuse, reject. What word would you use there? Spin it however you like. The end result was the same. Marianne Thomas, the Health Minister, decided not to take the advice of the Chief Health Officer to reintroduce mask requirements, knowing that if she had taken the advice, the state would have seen a reduction in COVID infections and hospitalisations by up to 20% and deaths by up to 15% in the coming 3-month period. So let's take a look at some COVID numbers or the public health consequences of the Health Minister's decision. From the 7th of July, the day Marianne Thomas was provided the health advice, until the 31st of September 2022, the period for which the advice applied, there were just over 460,000 cases reported in Victoria. The number of people in hospital on a given day peaked at just over 900. 1,631 Victorians died in this period. Now, had Marianne Thomas taken the health advice that the CHO had given her on the 7th of July, up to 92,500 cases could have been prevented, up to 180 hospital beds freed up at the peak, and 245 Victorian deaths prevented. In failing to prevent the additional 92,500 COVID cases, 5 to 10% of those people will develop long COVID based on the current Australian numbers. Even if we take the low end, 5%, that's almost 5,000 people with long COVID. The direct result of the decision by Marianne Thomas was additional strain on an already stressed healthcare system. Gentle reminder here, the Victorian Health Minister is responsible for the health and well-being of all Victorians and ensuring a strong public health system. This leads into the next point. The media screeching about a crumbling healthcare system. Really need to break this one down into two parts. First, how loud was the screeching? Secondly, what triggered it and was it deserved? I don't like to regard the Herald Sun as media, but I made an exception here and looked at the front pages from August through to the Victorian election in November. To be honest, I was expecting more. Health did occasionally rate a mention on the front page, but when it did, it was usually a fairly large issue. The kind of thing you'd expect any news outlet to cover anyway. The Hun focused far more on the Premier's suburban rail loop project, his dealings with IBAC and the gutter stuff around the staircase, which I've talked about before. But what else happened around 90 days before the Victorian election? Well, the Victorian government tried to quietly drop the review of Victoria's emergency ambulance call answer performance.
More than 30 deaths have now been linked to Victoria's 000 crisis. A report into the emergency call system has found it was underfunded and understaffed while delivering the worst results in its history.
Reality is you don't release anything on a Saturday in Melbourne to coincide with the first weekend of the AFL finals if you want the maximum number of eyeballs on it. There are a number of findings from the review. The report was big. It was newsworthy. It highlighted an arm of the healthcare system that was in crisis and had been for some time. Some of the key findings included that Esther did not meet the primary ambulance emergency call answer speed benchmark in any month from December 2020 to June 2022. Call volume increases from December 2020 to June 2022 alone did not lead to the Emergency Services Telecommunications Authority's non-compliant performance. From the 1st of July 2021 to 31st of May 2022 inclusive, Esther reported 40 potential adverse events associated with call answer delays and/or agency command and control issues. In these events, 33 patients did not survive their emergency. The funding model for Esther is insufficient and does not provide adequate funding to cover its costs. The kicker here, the Victorian government was aware of Esther's precarious financial position as early as 2015. Slight segue. So apparently The Age started this uniquely Victorian crisis thing. For what it's worth though, The Age never painted the public health crisis as a uniquely Victorian one. They did, however, report that the breakdown of the Victorian 000 service was uniquely Victorian. Why? Because it was. As Tony Pearce, Inspector General for Emergency Management, highlights in his report, the problems faced by Esther were uniquely Victorian. Because Victoria is unique in that it has Esther as the single authority which takes all 000 calls and dispatches all manner of emergency services. No other jurisdiction in Australia is structured this way. Unique.
Wait, there's more.
Victoria's 000 call taker Esther knew how bad COVID could get as early as 2020.
The numbers they came up with were very close to the numbers that actually occurred during the peak.
Tony Pearce wrote the report that's linked the deaths of 33 Victorians to call-taking delays, contradicting this statement made by the Premier yesterday.
The extent of how overwhelmed the system was not foreseeable.
History showed what was going to happen. Unfortunately, the funding did then not compensate for what we knew was coming.
New South Wales and Queensland aggressively hired call takers in the middle of 2020.
Had New South Wales and Queensland done nothing but simply stick to a business as usual model, they would have been in the same situation that Victoria was. That was the difference.
In the lead up to the election, The Age reported on Operation Daintree, an IBAC investigation said to be the first known inquiry to closely query Premier Daniel Andrews' personal actions. It may or may not have surprised people to find that The Age's story featured the Premier, healthcare, a few $1 million, and a health workers union, not shy of threatening to campaign against the Labor Party if they didn't get their way.
That really happened?
It really happened.
The issue with that story being picked up by the media was not that it received media coverage. The issue is that Victoria's IBAC is so hamstrung in when it can hold public investigations that we needed to wait for the media to report on it before we knew about it in the first place.
The injunction.
What this doesn't say is that the reason IBAC were granted the injunction was clear. The Justice granted the injunction to restrain The Age publishing further information because it may have been derived from a draft report of the investigation, and IBAC believed that somebody had either passed on the draft report or at least read out or conveyed key parts of the information from within that report to a journalist at The Age. This is the sort of story we should be wanting our media to cover, or are we saying it should only cover it if it's the other team being implicated? So in the 3 months leading up to the election, we had a health minister ignoring health advice, we had a report into the failings of the Victorian government's handling of Esther, released in a truly bad news dump style, we had news of Operation Daintree surface, all against the background of a state performing worse than its northern neighbour with respect to COVID-19 health outcomes. These are very much Victorian-specific issues, and I'd suggest that reporting on these issues should be the bare minimum we should expect from our media. Now to the point that issues in New South Wales are met with almost total silence. The narrative that the media in New South Wales are silent on the faults with the New South Wales healthcare system is false.
Then what about it?
If the media were truly silent on New South Wales failures, I would not have known that their ambulance wait times in the state had hit a 10-year low. When the hospital wait times in New South Wales pushed out and patients were walking out of emergency without being seen, I knew about it. Why? Because it was receiving significant media coverage.
Good evening. Our ambulance service is in crisis. Unions claim the New South Wales ambulance service is at breaking point.
Ambulance response times have blown out to levels not seen in more than 30 years.
Ambulance ramping and access block in New South Wales is the worst it's ever been.
According to the experts, our health system is the sickest it's been.
A hospital under strain leaves a patient in the sun on a stretcher at Hawkesbury Hospital. The hospital says the patient had COVID and was left outside for 20 minutes while an isolation room was prepared.
The impact of Omicron is still drastically impacting the health system, blowing out elective surgery times for children.
Okay, so to close this out, because this video is already long enough, media screeching
Hyperbole
about Victoria's crumbling health system.
Well, that's hyperbolic.
Glossing over the fact that a healthcare system on the verge of collapse is something that deserves attention. Falsely framing the national crisis as uniquely Victorian, led by The Age, that's a factual liberty. New South Wales, where everything's worse.
False!
Almost total silence from the media.
That is false.
He was right about one thing. I do have an axe to grind. I just don't like gaslighting. And this was gaslighting. So was this, and this.
Oh dear.
And this, and this.
Pretty much everything.
And this.
You get the idea.
Sure, the media can be biased. Traditional media and social media. Biases everywhere. It's easy to shout media bias and point elsewhere to distract from the fact that the house is on fire. But maybe, just maybe, we shouldn't be so quick to label valid criticism as bias. Rather than gaslighting, rewriting history and playing games of look over there, I'd much rather he put his platform to some good use and advocate that the government he's so attached to do better when it comes to public health. Because I think we can all agree that at the moment there's plenty of room for improvement.